Research indicates that working-age veterans have a 7.4% higher risk of experiencing food insecurity compared to non-veterans. That statistic is even higher for disabled vets. Caitlin Welch is director for the Global Food Security Program at the Center for Strategic and International Studies. Caitlin, welcome to the program.
Thanks for having me, Mimi. Good morning.
So let's talk first about the factors that cause higher food insecurity for vets. What are those factors?
Yeah, thanks again for mentioning the report that you noted, which was published about last year. It was the largest and most nationally representative study of food insecurity in the veteran community, showing that veterans have a 7.4% greater risk of food insecurity than non-veterans. The most significant contributor to that statistic is the higher rates of physical and mental health challenges and disability among veterans.
And age was another factor, with younger vets being more likely to be food insecure than older vets. Why is that?
Yeah, that might be a bit counterintuitive, but one of the factors there is that the transition from active duty service into veteran status is a period of particular vulnerability for new veterans. So that's one of the main reasons that we see higher rates of food insecurity among the younger veteran population.
And why is that specifically, though? Is it because they have a hard time adjusting to civilian life? Is it that they have a hard time finding a job? What's going on there?
Yeah, I think it's a number of factors. I think it's simply a transition time to finding steady employment. I think it's often the case that veterans are supporting entire families and can't find employment that is sufficient to meet the economic needs of entire families. So those are some of the reasons why you see higher rates of food insecurity among the new veterans.
And women are more likely to be food insecure than men, which I thought was surprising.
Yeah, that's something that is also true in the population in general. Consistently, you see that women are more likely to be food insecure and are more food insecure than men across the board. That's also true in the veteran population. One of the reasons for that among vets in particular is that women don't advance as far as men do in the armed services, and so when they that affects the employment that they can secure once they enter civilian life. And then, of course, economic status is one of the main factors that contributes to food security across the country.
And when more women are food insecure, that will affect their children and families and have a ripple effect as well.
Absolutely, yeah, for their own their own children, yeah, it's a huge problem.
What have the trends been, Caitlin? Has food insecurity among vets been going down or up over the past years?
That's a great question because it's actually something that we've only started to recently measure. It was not until 2017 that the Department of Veterans Affairs Veterans Health Administration started to survey veterans about their food security status. It was a really simple survey. It was one question. They tweaked that survey last year, but really it's only the past 5 years or so that we've even been measuring this. And even then, it's only veterans that are availing themselves of services at the VA and not the veterans who the VA can't capture. So it's something that we're only recently studying.
And do we have enough data to really see a trend over those 5 years?
Probably not. It's something that I think it's quite interesting. A few years ago, the Washington Post put out a piece where they said that food insecurity among veterans has long flown under the policy radar. So it really has been under the radar for policymakers and for researchers. We don't necessarily see trends in terms of food insecurity going up or down, but what we do see is how trends in the composition of the military is affecting food insecurity among veterans. So, for example, today there are higher numbers of women serving in the armed services, people of color in the armed services, and again, women have higher rates of food insecurity writ large. People of color have higher rates of food insecurity writ large. So when you have higher proportions of those populations among veterans, you're going to see higher food insecurity among veterans generally.
So what federal resources are available for these veterans? You'd mentioned the VA.
Yeah, yep. So the Department of Veterans Affairs screens veterans for food insecurity. A few years ago, Feeding America set up a pilot program with the VA to establish food pantries at several VA sites. So that's one source. But that certainly is not enough to meet the problems of veterans across the board. So there are federal programs like SNAP and WIC, which SNAP is food stamps, WIC is food stamps specifically for women, infants, and children. You have regional programs. For example, Purdue University set up a program to address the needs of veterans in rural areas in the Midwest. So you have some nationwide programs, you have some regional programs, which are going some distance to meet the challenges of veterans, but not the whole way.
Do you think it's enough, Caitlin? What would you recommend changing?
Yeah, I don't think it's enough. And I think that this comes back to your initial point, Mimi, about food insecurity among disabled veterans. I think what needs to happen is an examination of who is most food insecurity among the veteran population. And again, it is disabled vets. It's also female veterans, veterans of color. And I think that there needs to be a specific targeting of those populations to make sure that these resources are reaching them.
All right. Well, thank you, Caitlin, for being on the program, and thank you for your work on this for the veterans. We appreciate it.
Thank you. Thanks for spotlighting this.
Thank you for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.